Hello everyone, I'm Dr. Benedict Dharmaraj from Beacon Hospital. Today, I'm here to share on chest wall resection and reconstruction. Chest wall resection is a complex surgical procedure which involves removal of part of the chest wall, which includes skin, muscles and ribs. This procedure is performed for chest wall tumours, which can be either benign or malignant, in cases of traumas as well as infections. If more than 2 ribs are removed, it is imperative to reconstruct the chest wall. This is to prevent respiratory failure, to maintain the chest wall rigidity, and to protect the underlying organs, especially lungs, and it is also for cosmetic purposes. During this procedure, we use titanium plates and locking screws to replace the resected ribs. Often, the skin and muscular defects following this surgery are quite large, and this requires specialized techniques for closure. One of the more common techniques is to use the Latissimus dorsi or LD flap. The Latissimus dorsi is a large triangular muscle, and this muscle is located in the back, just beneath the shoulder blade. It is one of the largest muscles in the body and is responsible for movements like raising the arms and rotating the shoulder. The LD flap is effective in chest wall reconstruction, particularly to close large chest wall defects. Once the LD flap is harvested, it is carefully moved under the skin to the chest area. The flap is then positioned where the resection has occurred, and this covers the gap in the chest wall. One of the major benefits of using the LD flap is that it provides vascularized tissue. This means that it has its own blood supply, and this promotes healing and reduces the risk of infections. Patients are advised to avoid heavy lifting and strenuous activities in the first few months after surgery. This is to allow for proper healing. It is important to discuss with us on the treatment options to decide what is best for your condition. Beacon cares for you. Your health is our priority. Thank you.